Okay. The pre-filled injectable syringes. So we said these are syringes that already have a dose in them. Okay, it contains a single dose of medication. You see these a lot with the IV flushes, but it's just got um, the the medication for the flush. Okay, the normal saline that they flush the IV port with and everything else. It's already in the syringe. It's ready to go. It's got a little screw-on cap on it, so it's easy to handle and everything else. So it's just a single dose. It's already pre-filled. Just saves you some time. Okay. Now, if the order calls for less than the supplied amount, the nurse is going to adjust the dose by discarding or wasting the unneeded amount before they give the medication. Okay. So, you do all your dosage calculation stuff, the milliliter per dose, and you figure out how much you need. If your pre-filled syringe has more than that, eliminate some. Okay, so push some out into the trash can or sink or something and discard the extra before you give the medication to the patient. Okay, it just makes for some easier math there. There is a note here that says watch your manufacturer's recommendations. For example, there is a drug, enoxaparin, I'm sorry. This E drug comes pre-filled, but there's also an air bubble that you have to keep while you are wasting the medication. Okay, so there is an air bubble. You just got to be sure and keep the air bubble in the syringe even as you're wasting that medication. So the air bubble is going to be very important. You don't want to waste the air bubble. And you always waste in the appropriate medication waste container for proper disposal. Okay, and you'll learn more about that later, whether it's the trash can or the sink or a napkin, whatever. Okay, you'll learn about those proper waste sites. Here's an example of another type of pre-filled syringe. Okay, so these injectables have their own little cartridge that holds this little pre-filled syringe. Okay, so you just slide this little glass piece, and it's already got its needle in there and everything. You just slide this into this cartridge, and then you can use the little plunger to give the medication for that. Okay, and I think this is an older system. I've seen my dentist office use it, but I don't think I've seen many doctors, nurses, clinics. I don't think I've seen that in very many of those places. So just another way that they will do pre-filled syringes. Okay, let's dig deeper in the needle things. Okay, so a needle size. When you hear somebody refer to the size of a needle, they're going to talk to you about two different aspects of it, the length and the gauge. Okay, so the needle length, if you were given an intermuscular shot, your needle length needs to be 1 to 2 inches because it's got to get through all these layers of the skin down into the muscle. Okay, so it does need to be a lengthy needle. If you're given a subcutaneous shot, it can be 3/8 to 5/8 of an inch. If you're given an intradermal shot, that's going right here under the epidermis. It's really shallow, so you can go 3/8 to 1/2 of an inch. The needle gauge refers to the diameter of the shaft, okay, the bore size. So the lower the gauge number, that's the larger diameter. Okay, so you can associate the L's together. The lower the number, larger the diameter. So typical sizes are 16, 18, 20, 21, 22, 23, 25. Okay, all those are different gauges of a needle. So your 16 gauge needle is larger than a 25 gauge needle. Okay, so it makes sense. The lower the number, the larger the diameter. Okay, a 16 gauge is bigger than a 25 gauge needle. So how do we pick out what needle? I mean, we've got our lengths, and we've got our different gauges, but a lot of times the needle selection is based on the purpose and the route of the injection, okay, whether it's going intermuscular or subcu, the size and skin integrity of the patient, okay, so, if your patient's got some thick skin, if they're, say, a farmer, and, their forearm is out in the sun all day, every day, their skin's going to be pretty thick and hard. Okay, so you might need a thicker needle for that. Also, the viscosity of the solution. We talked about those highly viscous solutions like blood products are going to need a thicker needle. Okay, they recommend an 18 gauge anytime you're doing blood products. So I've got this little picture that I think I just found it offline somewhere. But you're, just different. You can see the thickness of that 18 gauge versus the thinness of a 25 gauge. Okay, and you can see the different lengths all stacked up there together. 1.5 inches versus 1 inch versus 3/4, 5/8. Okay, so that's just kind of neat to see. And the color coding that they use on these, it's going to be consistent within the facility that you work at. Okay, but if you are a traveling nurse, you may not see that all 18 gauge needles are pink in all the facilities that you work at. It just depends on who your supplier is. But if you're going to work at NEA Baptist for the rest of your life, as long as they don't switch suppliers, then yeah, all their 18 gauge needles are going to be pink. Okay, so the color coding is there for a reason. It does help you determine, what gauge it is just by looking at the color, but it could change depending on who your supplier is. Okay, on page 213 you have this table of usual needle sizes and their purposes. Okay, so it's kind of neat to look through it and make sure you know what size, what gauge is used for what kind of medication. Like a 31 gauge, that is super, super thin. That's your subcutaneous insulin injections. Okay, those are the people that are having to poke themselves several times a day to give themselves insulin. So it is going to be a teeny tiny thin little syringe. A 27 to 30 gauge needle is the intradermal skin test, like that TB skin test, or sub-Q insulin injection. 25 to 27 gauge is subcutaneous injections or a heparin administration. A 22 gauge is used for spinal canal injections. 20 to 23 gauge is intramuscular. 16 to 20 is intravenous. 18 gauge is any of your blood products. Okay, because blood is pretty viscous. We need a thick needle for that. Okay, there's also a neat little thing. It's called a glass ampule. Okay, and these glass ampules are just teeny tiny little glass bottles, and they've got a lot of curvature right here around their cap. Okay, so it is a solid glass piece. There is no screw on, screw off. It doesn't pop on, pop off. You literally have to break off the tip, and you'll see these little lines right here in the neck of those bottles. Whenever you start pulling on the top, it is going to snap on that line every single time. That's how it's built. That's why it's built with that curve at the neck. So the tips of these glass ampules are broken off so that you can access the medication in there. But in order to pull out that liquid, you have to use a special filter needle. Okay, and this is going to let you draw out the medication without getting any kind of little bitty glass particles into your syringe. Okay, because you got to think, whenever you're snapping this top piece off, it could break off fragments of that glass into this medication. So you're going to use this filter needle, and they're not all purple tipped. I think the ones I've seen in class they have a green case on the outside of them. But anyways, in this filter needle, right in this piece here, is a filter. Okay, and you can even look down this little pipe here, and you'll see the filter. Alright, so it's there to filter out all the different glass fragments that are in there. These filter needles will not be used to pierce the skin. Okay, so I think we had a vocab word that was a hypodermic. Most of your needles are hypodermic. They're meant to go under the skin. A filter needle is not meant to. It's got a very blunt tip. It's going to really hurt your patient if you try to stick it into their skin. Okay, so filter needles are meant to just filter the liquid out of the bottle. Okay, make sure there's not any glass or any other fragments of stuff. Once you get your medication pulled up into the syringe, then you switch out your needles into a hypodermic that you can use to administer the drug. Okay, but filter needles are not hypodermic.